Hello, everyone. Welcome to the Liv Hospital. We are with Dr. Hamid Aydin.
Hello, Qunomedical team and Qunomedical patient from Istanbul. Greetings.
Welcome to the Liv session. We have prepared especially for Qunomedical patients. We are here with Dr. Hamid Aydin, who took a break from his surgeries. Patients has taken a break. They are having their lunch, special meals during the operation, and we have like around 30 minutes of time to go live on go live on Facebook. So I would like to give a brief introduction of Dr. Hamid Aydin. He's a doctor for 25 years, so he has 25 years of experience. Until now, he has he has performed around 10,000 hair transplant surgeries. He's been performing the FUE technique for 15 years. He's one of the first surgeons in Turkey to start performing the FUE technique here. And he's one of the first doctors who has started to do medical tourism, started to bring foreign patients in Turkey, and he contributed a lot to the development of FUE method and the medical tourism in Turkey, which is with the help of hair transplant patients, is one of the best destinations around the world for medical tourism. So we have received lots of questions from patients. Thanks to Qunomedical health managers, they have sent us the questions mostly asked by the patients, and also lots of patients has sent us questions to be answered during the live show on Facebook. So I'm gonna try to ask those questions to Dr. Hamid Aydin, and we're gonna try to answer those to help you, to give you informations about hair transplant surgeries and hair loss, obviously, more or less everything about the hair. So, doctor, should we start to the questions?
I'm ready for question and for answer.
So the first question, we are going to ask a couple of questions about hair loss. Then we're going to skip to the hair transplant procedures. So the first question is, I'm starting to notice hair loss. How long should I wait before considering a hair transplant?
Yeah, the patient must go into the specialist doctor firstly, and don't wait for the hair loss and do treatments your doctor says. Yeah, don't wait. This is very important. You must go into the specialist doctor.
So they have to consult their doctors.
Yes. Maybe doctor write a prescription. Maybe want to doing a hair transplantation operation, a different treatment. Yeah, this is very important.
So you should trust your doctor. The next question is, I have hair loss, but don't want to get a hair transplant just yet. What can I do to stop or slow my hair loss?
It's possible. There is some treatments for hair loss treatment. The first treatment for hair loss, this is a PRP treatment. And maybe the patient using finestride or minoxidil or hair mesotherapy treatment. And this treatment can slow the hair loss. But if you want to learn the first number of the stopping the hair loss, is hair transplantation.
So if you want to stop the hair loss, if you want to cure the hair loss, you have to do hair transplantation.
Yes. Maybe, example, some patient doing a PRP treatment for 1 year, and after 1 year doing a hair transplantation. It's possible. Or using some medicine, and with medicine plus hair transplantation together. This is a combined treatment, and this is better for hair loss treatment.
Thank you for the answer. So the third question is, what are some of the signs I should consider a hair transplant? Well, It's a really general question, doctor.
Yes.
It can change.
Yes,
person to
maybe if your hair is thinning, maybe if you're receding hairline, you must go to the doctor. And if your doctor maybe think PRP treatment, maybe hair transplantation may be a different treatment. But this is a general question.
Okay. For every patient, it can change.
Yes.
For every case.
Yes. For every case.
So these were the questions for about the hair loss. Do you guys have any questions? Because we are going to skip to the hair transplant procedure questions. So, doctor, there's this medical patient, Max, asking about minoxidil and finastride.
Finastride.
He says it's bad for sperm and prostate.
Yes.
And he's afraid to do hair transplantation because he then after the operation he should use he will be using these drugs forever. Is that true?
This is a side effect of finastride, not minoxidil, but
no.
Yeah.
Minoxidil is locally applied?
Yes. This is a side effect of finastride, but this is a small risk, very, very small risk. This is less than 100% of total patient of using finastride. It's a small risk. The finastride or minoxidil is very, very good medicine for stopping the hair loss. You can use this.
Here I have to ask a couple of questions.
Yeah.
I'm facing by lots of patients here. So, for example, if I start using finastride, use it for 1 or 2 months, then I see the side effects.
Yes.
If I stop using it, will the side effects disappear and I will return back?
Yes, of course.
So this is important.
I say to you, this is a small problem.
Lots of patients are afraid.
And maybe he can change the medicine. He can stop the finastride and start the minoxidil. Example.
We can stop finastride and
start the.
Good question, Max. Thank you. And one last question about his question is that when patients do hair transplant surgeries, after the surgery, do they have to keep using minoxidil or finastride to have a good result, or hair transplant alone without drugs is enough?
The combination treatment is better. All of the time. After hair transplantation, if the patient using a minoxidil or finastride together, this is a better treatment than just hair transplantation. Yes.
So, do you guys have any other questions about hair loss? I think that you can skip to the hair transplant procedure questions. I hope we were able to answer your question, Max. Yeah. If you have any other questions about hair loss or the hair transplantation, you can ask. Feel free to ask us. So the first question of hair transplant procedure: who is a suitable hair transplant candidate?
If the people age is more than 18, we can do for this patient a hair transplantation. But for this must be the patient's hair loss problems, and the thing of the doctor and the patient must be the same. The doctor, you cannot need a hair transplantation. We cannot make a hair transplantation for this patient. It's very, very important. Sometimes the patient wants a hair transplantation, but the doctor no. You must using a medicine. You must doing a PRP treatment or hair mesotherapy. This is better for you. Generally, for the woman patient, is example PRP treatment or hair mesotherapy is better than hair transplantation in some cases. But For some cases, the patient, one using as example minoxidil of finastride, but this patient, typical a hair transplantation patient. And the doctor, no, I cannot doing for you to PRP treatment or hair mesotherapy or medicine, just you must using doing a hair transplantation. The thing of the doctor is very, very important, very, very important in all cases.
So we can say that in this kind of situations, we should consult a doctor we trust.
Yes.
And we should
maybe online consultation is enough for the patient.
Yeah. Have you? I would like to ask a question myself. Have you ever refused a patient who was asking for hair transplants? Have you refused the patient, rejected the patient because he didn't need it? Hair transplant, but he needed PRP or other treatments.
Yes.
So we're gonna ask another question. What should I know before booking a hair transplant?
Yeah, this is a very important question. In my show, make your research well. An example, this is a basic. Write the name of your doctor to the YouTube example and watch videos and write to the Google and learn the patient number of this doctor, your doctor. Example, 100 patients to be expert a hair transplantation doctor is not enough. In my back, about 10,000 hair transplantation patients. This is a big number. And this number is for my team. The patient must learn your doctor, the doctor and the team and the hospital example. This hospital is certified by the GCI or not. It's very important. Example, the doctor is a member of International Society of Hair Restoration Surgery or not. This is very, very important.
It's ISHRS.
Yes. This is very, very important. Very, very important. And certified and example, the testimonial or comment of the patient of the doctor before is very important.
For example, you can go write the name of Dr. Hamid Aydin on Google, on YouTube, on any website you can find him. Also, you can find him on ishrs.com. If it's Dr. Hamid Aydin or any other doctor, go and do a good research. Don't just do what's happening there? Oh, there were hearts.
Oh.
So just do a good research, and I think reading patients' reviews, patients' comments is really, really important because they're objective thoughts of people who has been here. So the next question, wow, a general question. How does the procedure work?
Oh, procedure work. This is a long answer for this question. After booking with Qunomedical, you will fly to Istanbul. When you land, our driver will welcome and take you to the hotel. And next day, we will take you to the hospital, and doctors and the team will welcome you. We will do your blood test and PRP and shave your hair. And after this time, the patient ready for hair transplantation operation. Operation start the pre-anesthesia. This very, very important for stopping the pain. Pre-anesthesia. This no needle anesthesia. We don't. It's first the pre-anesthesia and after local anesthesia. And after this procedure, the patient cannot feel any pain in operation time.
It's it's a new technology.
Yes, a new
started
technology.
using
Very,
at
new
least
technology.
using one or 2 years.
1 year, about 1 year.
It helps a lot.
Yes, it's not cheap, but we are using this technology.
It's important for the patient.
Yes, very, very, very. After the pre-needle anesthesia, pro-anesthesia, we're starting a standard local anesthesia. And after that, we will start the extraction with micromotor. And after this, the doctor came and opening the hole of the channel. And after this, the specialist nurse transferred in this will be keep in special liquid and stable temperature grafts put to this hole. And after this time, the operation finish.
Okay. Can I ask a question?
Yes, yes, of course.
What kind of slits you are using to do the channels and holes?
We are using for Qunomedical patients a sapphire slits. Before I want to show to the camera. For example, I have a three. This is a sapphire slit.
So sapphire slits or sapphire blades?
Did you see now?
Well, there's a sapphire tip.
Yeah, this is very thin.
This is a new instrument.
Yeah. Yes, very new.
We are using
about less than 1 year. That's about 8 months. We are using this instrument. The doctor using this instrument for opening the hole, and after dressing of the donor,
extracting the
after this we dressing the hair with the antibiotic pomade, and after the patient back to the hotel for the tomorrow he must come in for change the dressing, and the other day he must come in for first hair wash. And after this time, he came back to the country.
So, if we do quickly, if I explain it, the first day you arrive, you have to book with, you have to complete your booking with Qunomedical. Then you arrive to Turkey. The first day you will be free. The next day of your arrival, we will do your operation of your surgery. More or less, every procedure, medical procedure will be done that day. Your blood test, your doctor's consultation, your hair shaving. Then the operation will be done the same day. Then the same day you will be
blood test. Don't worry, please.
Sorry.
And blood test.
Yeah, blood test.
Yes,
and your PRP will be done the next day, the second day of your arrival. That day you will be sleeping at your hotel. The next day we will do the control. Then you can leave to your country. But if you have time, if you have 1 extra day, you can stay here in Istanbul, and we will be able to do the first wash here in the hospital by our technicians, by our specialists.
Yeah. Basic plan for a transplantation patient. The first day is operation day, and second day rest, and the other day first washing and back to the country. Yeah.
Thank you.
Yeah.
Thank you. Just one thing, guys. I'm sorry. I've answered Max's question, but then we have received other questions. I have seen them. I'm gonna check them again. We are gonna talk about second sessions, second transplants. Nick, we'll talk about it soon. So we will be answering it soon. Thank you, Omar, for your question. Omar asks, what is the biggest complication, possible complications of hair restoration surgery, and which side effects can be long-standing for a long time, for months, for years?
For operation time.
Now he asks the side effects, the complications. Yan etkiler hocam?
No.
Will be long, like 1 year, 2 years, maybe longer.
No, no, we don't see any side effect of after hair transplantation for a long time.
And what about complications during the operation?
But maybe in this time we need some photos from the patient. We check in this photo this problem, and maybe we can write some medicine for this problem. In some medicine, we can see example of infection, a little infection. For this problem, we are writing for 3 days, 2 times in a day, antibiotics, tablets. Maybe in some patient, we are using some painkiller, and some patient for antidiarrheal treatment, we can writing some prescription and medicine. But this is small side effects for hair transplantation at Liv Hospital.
And we can cure them.
Yes, yes.
Okay, we have to be a little faster. Sorry, because I was asking questions myself. Nick asked a question. I will give a quick answer myself. It depends on the patient. If the donor area is not dense enough, if we can't extract enough grafts, and if the receiving area is too much large, then a full coverage sometimes cannot be possible. It depends on the from patient to patient. Adnan Omar, we are going to answer a question like this soon. Wow, Daoud, it's a complicated question to answer. I can answer this on base of the experience. There are a couple more questions. We have to be a little faster. So for now, I'm gonna stick with the questions we defined before.
Maybe you can answer after live.
Yeah, we can answer them after this session.
It's funny for me.
Doctor has to go, but I think I can be able to help you with some of the questions. Yeah, this is important. I think patients usually ask this question: what part of the procedure is performed by a doctor, and what part is done by the technicians or specialists?
Yeah. Like most of the surgeries, hair transplant is a procedure done by a team, including doctors, specialists, and technicians. Example, we have 3 doctor, hair transplantation specialists, 3 doctor, and our job is planning and examining and opening the hole, part 2 of hair transplantation. But we have 14 implantation technicians, and the job of this team is just transplantation of the graft to this hole. And we have 7 extraction specialists, and the job of this team is just extraction of the graft.
Yes, specialized.
Yes, special for this job. The meaning of this the doctor can do example blood test, but this is not job of the doctor. It's job of the nurse.
Of technicians.
Yes, I can say to all of the patient, the examining of the patient and the planning of the operation. Example, for this area, the doctor say 2,000 graft is enough, and for this breach, 1,000 graft is enough, and for vertex, example, 500 graft is enough. It's job of the doctor. It's the planning of the operation, doing by the doctor, and the whole of the example, the opening of the hole is the job of the doctor, and the prescription, the job of the doctor, and this is for all patients, not just for one patient. For all patients, the opening of the hole, job of the doctor, and some jobs of the nurse.
It's a teamwork.
Yes, teamwork. Yes.
Thank you for the answer. Next question, very common question. It's, does the procedure hurt? Does the patients feel pain during the operation?
Yeah, the answer of this question is very short. If you are doing this operation at Liv Hospital, that you are a Qunomedical patient, our team using a anesthesia mesh, And after paralysis, you cannot feel any pain.
Enough.
Yeah, enough.
Good answer. Quick question, so we can skip. Next one. How long does a hair transplant take? I think I can answer this question.
Yes.
It takes like, because we don't have too much time. I'm sorry everyone. I'm sorry gentlemen. It will be around 6 hours. It can be a little more, a little less. It depends on the graft number.
Yes.
So here the important thing is not the timing of the operation. It can be 6 hours, 7 hours, or 5 hours. Here the important thing is that it's a good hair transplantation. The important thing is getting a good result, getting the best result for each patient. I'm going to next.
Yes, yeah. For a good result, maybe the operation time long than 1 hour than as standard time. Yeah, it doesn't matter.
Important is the patient.
Yes, yes.
So the next question. I can't take much time off work. How long should I be in Turkey if I want to travel abroad for treatment?
Yeah, 2 nights and 3 days is enough for this operation.
Thank you.
Yeah.
We have lots of questions about drugs. İlaçlarla ilgili. Bayağı soru geliyor. Cevap vermemiz lazım. How long does hair transplant surgery last? Will I have to get more procedures later? I think he means how long the transplanted hair stay, and after a couple of years, do they fall and do I have to redo the surgery? Would you like to answer?
Yeah.
Does the transplanted hair fall in the future, or they will stay?
No, don't fall. This will stay for. But in some cases, maybe one session is not enough for hair transplantation, and the patient needs a second session. During the examining before hair transplantation, the doctor generally say to the patient, the one session of hair transplantation is not enough for you. You need a 2 session, maybe 3. But generally, the 55% of all of the hair transplantation patient need just one hair transplantation. One session is enough. But
So-
in some case 2,
So
in some
the-
case 3.
So if we will have to get a second session, it's because the patient's need, the patient's opening is bigger than one session. So you don't have to redo again the same hair transplant in the future.
Yeah.
The transplanted hair will stay.
Example, if the patient need a 6,000 grafts, we cannot operate this number in one session. We need 2 sessions. Example, for first session 3,500 graft and second session 2,500 graft. The total graft number is 6,000.
Thank you.
Yeah.
Thank you for the answer. Next question is, my crown is particularly bald. Can I focus my treatment on this area?
Yes, after graft extraction, the patient owner of the graft, we can add example for here or here. Doesn't matter. Yeah.
It depends
possible.
what the patient wants.
Yes.
Next question. Will I have any scarring after the operation?
Yeah, if we're doing a FUT technique, I can answer this question, yes. But in FUA technique with micromotor, maybe a small dots, just we don't see as
how long after surgery these dots will be invisible?
3 weeks.
Yes. After
maximum,
3 weeks.
Maximum 3
After
weeks.
3 weeks.
Yes.
Only hair transplant doctors will see the scars.
Yes.
So be careful if you had hair transplant. Just be careful about hair transplant surgeons. They will understand you that they may understand you need the surgery. So, next question. We have already talked about a little about the second session. This question is about second session, but I'm gonna still ask about it. There are a couple informations we haven't gave. So the question is, I have already had one hair transplant, but want to get another one to get more coverage. How soon can I have a second transplant? First question is this.
Yeah, he must waiting about 6 or 8 months firstly, but after 1 year is better than this time for second session.
How and from where do they harvest grafts second time, the second session?
Yeah, for example, if we do a first session for hair transplantation for 3,500 grafts. And for second session, we cannot do a same operation, 3,500 or 4,000 grafts. The number for second session is 2,500, maybe 2,000, maybe 2,200 grafts. We are using for this in just same the donor.
Same donor.
Yes.
Back side of the hand.
But the graft number less than first. Every time.
Can the grafts from the same area harvested again? Yes, it is possible. Second operation is only for people with big enough donor area.
Yeah.
Or anyone, an average medium person can do 2 sessions.
For 2 sessions, 30-35% needed 2 sessions. But generally, 1 session is enough. Yeah.
Okay.
65 or 70 percent is need just 1 session.
Okay. So we have completed the hair transplant procedure questions. I'm gonna check the questions you have sent, guys, and try to answer some of them. If you have other questions, you can ask. We are gonna skip the next part. Is hair transplant aftercare. You have to be faster than this. Is Saw Palmetto is good as finastride?
Yes, he can use as a Saw Palmetto this same effect of the finastride.
Okay,
but don't use together. Yeah,
sorry,
don't use together.
One or another,
yes.
Saw Palmetto or finastride.
Finastride.
Thank you, Scott, for the question. I think you got the answers. What are the benefits of taking drugs? Which drugs are we talking about in this question? Antibiotics or finastride or minoxidil? Does everyone have to take drugs after hair transplantation? I can answer this question. The first couple of days you have to use antibiotics and anti-inflammatory medicines, drugs. So you have to do that, take those medicines. But for minoxidil and finastride, do they have to do it or it's optional?
Yes. I think after operation, the doctor can say the answer of this question.
So they should follow doctor's comments.
Yes.
Why do some people's graft implants they don't take or grow? Neden file olur?
The answer of this question very long, because some patient, example, have desires, and maybe the effect of the medicine We are using, as an example, some antibiotics and painkiller and anti-edema treatment. And the effect of this medicine may be the graft number less the effect of the operation, maybe. But generally, the percent of the risk for front area, 7%. It's not a big number. And for vertex, 15 or 20%.
For the frontal area, the percentage, the possibility, the probability of not growing, the implant grafts is around 7%, and for the crown area, it can be around 15 to 20%. But these are just average numbers. It can be less or more. It changes from people to people. We have two. Thank you, Marcin, for the question. Is a dandruff an obstacle for a hair transplant?
We are writing a special shampoo for this problem after hair transplantation. It's no important.
You can use special shampoos before, and then do the hair transplant operation. We have another question from Anna. Thank you for the question. Will sex increase hair loss, and will weight loss cause hair loss?
The hair loss is if the time of the hair loss and hair transplantation is same, it's dangerous for hair transplantation.
You mean the sexual intercourse? Sex?
No, not important.
Sex doesn't have any effect on the hair loss. No. Weight loss? Not surgery. I don't think he means surgery. Just doing diets, eating less.
Yes, the diet. If the patient doing a diet, we say to the patient, wait about example of 6 months, and after 6 months you can do your operation.
For the operation.
Yes.
Before the operation.
Yes.
Okay, thank you guys for the questions. We have to be faster. I'm seeing we are receiving lots of questions. Doctor doesn't have too much time.
Yes.
So I'm gonna pick a couple of more questions.
Maybe for a second.
Yeah, we can do a second live session if you want, if you're guys interested in, because we are receiving lots of questions. I have to be a little more faster than that because they're calling for the doctor. So I'm gonna pick a couple of questions. There's a question about pain after the procedure. No, just a little discomfort. By the way, we have skipped to the aftercare questions. So this question is good. This is good. It has been more than 6 months since my hair transplant, but I'm still patchy on my scalp. Will I see any new hair growth from month 6 to 1 year plus?
Be patient. The effect for proximal effect after hair transplantation is 1 year, not 6 months. Yeah.
They have to be patient. But after 6 months, will they see getting better?
Yes, of course.
If you give a percentage
for 6 months, 50-55%
of the transplanted hair will be gone.
Yes.
So they have around 45 to
50%
50% more.
Yes. Perfect.
So be patient, guys.
Be patient.
How many weeks can you shave your head with electric razor after hair transplant? I'm gonna answer this. After 2 weeks, you can.
Yes, for donor area 2 weeks, and for transplantation area 2 months.
Okay. Yes. Is it normal to still have numbness after 6 months?
Yes, normally must be finished after 2 months, but it will go away you must consult your doctor about this.
But usually it goes away in 2 months.
Yes.
After 2 months, you should consult your doctor. It's not, don't panic, but
Yes.
it's better that the doctor sees it and consults.
Maybe the patient needs some medicine, for good example, for transplantation area or donor area.
Thank you. Another question is, how long after treatment can patients play physical sports?
For soft physical, 2 weeks is enough. But for heart, 2 months, maybe more than 2 months.
For example, if the patients want to play football,
2 months.
2 months.
Yeah,
because there's physical contact.
Yes. Okay. But for shopping, for walking, 2 weeks enough.
Thank you. I have to return to work soon after my hair transplant. How can I reduce swelling and redness? This question is really, it depends on the patient. If you have swelling after like 10 days after the operation, I'm answering this question. So if you have swelling after 10 days, you should consult your doctor.
Yes.
If the redness is too much visible, consult your doctor. So for the answer of this question is, it's better to consult your doctor. He will be giving you the best treatments for swelling and the redness. Good question. Probably our last question. I'm experiencing concerning hair loss in the shower 4 months after my procedure. I'm nervous about taking finastride. What can I do?
Yeah, the hair transplantation cannot stop the hair loss. For hair loss treatment, he must maybe patient doing a PRP treatment or hair mesotherapy or using some medicines, minoxidil or finastride or different. And this is a different disease, and the treatment of disease is different. Every patient, this is a new case for me. If the patient, example, have a hair loss, maybe I can say to him, you need a hair transplantation, and some case PRP treatment, and some case hair mesotherapy, and some case just hair transplantation, a special shampoo, maybe.
A special shampoo for?
Yes, for some hair loss treatments. Yeah. Don't afraid. This is a normal, maybe. If you contact with your doctor, maybe your doctor write for you a special prescription for this problem.
So we have answered all the questions we have received before the show. Well, we have a couple of more minutes. I'm gonna try to answer 1 or 2 questions. For after the operation, after how much time patients can go to gym and do weightlifting?
For gym, 2 weeks, but for hard sports, 2 months.
Weightlifting?
It's about one
1 month.
Yes.
Boxing?
Oh no. I think after 1 year.
Sorry, Leon. Thank you for the question, by the way.
I think it's enough.
Yeah.
45 minutes.
Yeah.
Okay.
Thank you, guys. It was fun. I hope you have learned lots of things about hair transplantation procedures, aftercare, hair loss. We have tried to answer most of the questions, but we don't have too much time. Maybe we will do a second session. I don't know. We will plan for it. So thank you again for watching us. See you again next time. Thank you, doctor, for your time. Your patients are waiting for you.
My patient in future.
Oh no, no.
Okay. See you again. Thank you.
Goodbye.
Bye bye.
Book with Qunomedical. We are waiting for you.